A wound vac, or negative pressure wound therapy, (NPWT), promotes healing of chronic or acute wounds. It applies controlled suction to the wound area. This draws out fluids, reduces swelling, and encourages healthy tissue growth. How a wound vac works. The wound vac system consists of a foam dressing cut to fit the wound, a suction tube, and a vacuum pump. The foam dressing is placed on the wound bed, then covered with an airtight adhesive drape. The tube connects to the vacuum pump, creating negative pressure, a suction effect. The suction pulls out excess fluid, reduces swelling, and increases blood flow. It draws the wound edges together, removes bacteria and debris, creating a cleaner environment. Lastly, it promotes granulation tissue formation, helping the wound heal from the inside out. Who needs a wound? VAC. Wound vac therapy is used for chronic wounds like diabetic ulcers, venous stasis ulcers, and bed sores. Surgical wounds, especially large or deep ones. Traumatic wounds like large lacerations or avulsions. Burns to help heal large areas. Wounds with exposed bone or tendon. Skin grafts ensuring proper adhesion and healing. Why are osteomyelitis patients treated with a wound vac? Osteomyelitis is a bone infection, often linked to open or slow-healing wounds. A wound vac reduces infection risk by removing fluids, debris, and bacteria. It promotes faster healing by enhancing blood flow and new tissue growth. The negative pressure helps clean the wound, preventing further infection. Can patients use a wound vac at home? Yes, many patients use a wound vac at home after training. Portable units allow continuous therapy outside the hospital. Regular follow-ups are necessary to monitor and adjust treatment. Is a wound vac a vacuum system? Yes, it uses suction to draw fluids away from the wound, keeping it clean and promoting faster healing. VAC stands for vacuum-assisted closure. Benefits of wound vac therapy. It removes excess fluid, reducing swelling and infection risk. It improves blood flow, promoting oxygen and nutrient delivery for healing. It accelerates healing, closing the wound more quickly. It supports wound closure by applying continuous pressure. Risks or drawbacks. While the Wound VAC is effective, there are risks. Pain or discomfort. Patients may feel discomfort during dressing changes. Bleeding. If the wound involves blood vessels, there's a risk of bleeding. Infection. Improper use or infrequent dressing changes can increase infection risk. Summary. The Wound VAC is a specialized medical device that uses suction or negative pressure to promote faster healing of chronic or complex wounds. It is useful for patients with difficult-to-heal wounds, including osteomyelitis, as it removes infectious material and encourages new tissue growth. Patients can use the Wound VAC at home under medical guidance.